in my notes, I asked you about the ovarian cycle. What did you tell me what ovarian cycle was? What are the phases of ovarian cycle? You said one, follicular phase, where the follicle is growing, right? Where the follicles are actually growing, which takes about 14 days, right? The second phase would be ovulation. And the third phase will be what? Formation of corpus luteum, remember this? Or luteal phase. These are the three phases of the ovarian cycle. Which, by the way, there's an overlap with this. We talked about uterine cycle or menstruation. How does that happen? So I'm not going to worry about it. I'll let physiology class you worry about the uterine cycle and how it overlaps with this one and how the phases work with this one. But I think this is simple enough. So for you to know that when the follicle stimulating hormone is released, stimulates these follicles, which takes about 14 days. Ovulation happens. After ovulation, corpus luteum is formed. If I ask you, Rachel, what's the main function of the corpus luteum? What does it do after this follicle, after the egg is released? By the way, the female eggs are called oocyte. Oocyte. After the oocyte is released, right? What is the function of the corpus luteum? To do what?
Release progesterone?
Yes, estrogen and progesterone. Why? Yeah, so basically telling you that you're pregnant. Hey, wait a minute, I'm not pregnant. I swear I'm not pregnant, but it doesn't care. Every time ovulation happens, the assumption is that you're pregnant. So however many times happens in your life, 500 times in your reproductive life, that means you have 500 babies. Can you imagine how much fun would that be, 500 babies? So yes, basically this is every time ovulation happens, that is the assumption. So that means this guy here, the corpus luteum releases two hormones, estrogen and progesterone. And these two hormones are basically maintaining the endometrius and the lining of the uterus. So if there's a baby to be made, there'll be opportunity for the baby to be implanted in that region and grow. Some people call it parasites, but babies are the proper term, can grow in the uterus. Yes, parasites is a better term. So now what happens if a person is not pregnant? So this body that here, as I said, this one also takes about 10 to 14 days. If the person is not pregnant, this ultimately is going to become scar tissue. So if you take two ovaries of somebody who's 16 years old, 17 years old, compared to ovary of somebody who's 45 years old, you're going to find a lot of scar tissue on the 45-year-old female on the surface of the ovary. By the way, these are all cross-section of it, because any diagram that you look, it shows a circle like this, there's nothing like this. This is just an easy representation. So usually follicles grow and then bubbles from the surface of the ovary. So kind of like a little burn bubble, a little bit of bubble like, you blow a bubble, you can actually see from the surface of the ovary, bubbles up, allows the egg out, and then that becomes scar tissue. So if you older person will have a lot more ovulation, obviously the ovaries will be lined with all those scar tissues. Now, if a person is pregnant, what happens? Because this guy, ultimately, remember, 10 to 14 days, this guy's gone. And we know, by the way, those of you taking birth control pills, you know the birth control pills are doing constantly giving you some of this. As a result, telling you that you're pregnant. So you're good. So what happens if you are pregnant, then this guy's going to be destroyed eventually. And then, but the production of these guys have to stay. They have to continue. How does it continue? By what? By the placenta. Yes, it's actually interesting. When you do take-home tests for pregnancy, you can actually show that's basically you're looking for, it's called a human gonadotropic hormone. It's something that, or chorionic hormone, sorry, human chorionic hormone. So you're testing for that. So basically showing if that hormone is in your blood, that tells you that probably there's a little parasite in the process of making. So in the process of making, they release hormone, and that hormone basically maintains the lining of the uterus. So as a result, you can continue having the baby and the growth of the baby, and everything will be fine. So that's basically, in a nutshell, this is the female structures. So I talked about the same thing: hypothalamus, gonadotropin releasing hormone; anterior pituitary, follicle stimulating, luteinizing hormone. Follicle stimulating hormone stimulates the follicles, which creates this ovarian cycle that we talked about. Ovarian cycle happens in 3 phases. And production of estrogen and progesterone occurs, and of course this is done by the corpus luteum, or yellow body, that actually produces these hormones. And basically, this is it. I think there are a couple of little things in my lecture notes. I will quickly go over it, and if you have any questions, you'll ask them, and we should be good. Just give me 5 minutes. Let me start up this for somebody turning off the computer, which is frustrating because they do that all the time. I don't know what's the point, but we'll try to get this going.
He didn't ask about any dogs. What? Dogs. The hell changer though. Changes. That's why I'm like, should I even tell you like what's gonna be on there or what's not?
Yeah, there's no way it could be the same because then people.
Yeah.
But was there like a more like a focus on like was there a lot of like? I just feel like it's hard. Like it must be a little bit of everything.
There was like an ear model, one eye model.
Yeah, those are the
Those
easy.
were easily.
It sounds like there's more than the 2 cats, which is annoying.
There were probably like 5 cat questions.
5 cat questions or 5 cats with 2 questions. How to get there. I mean, there's multiple cats.